From the first case connected to a market in Wuhan city in China to cases across the world, conspiracies have run wild about the origin of the deadly coronavirus. Experts, however, believe the virus most likely originated from bats. We chart the coronavirus Covid-19 journey that has now affected close to 100 million people globally.
Thousands dead, millions infected, while others under quarantine. Countries are under lockdown. The coronavirus pandemic has caused devastating impact across the world. But how did the virus spread so fast? We have traced the virus from patient 0 in Wuhan city in China to across the world. In the 2011 film Contagion, a scene is set for a disease outbreak that threatens to destabilize the society. In the film, Beth Emhoff, acted by Gwyneth Paltrow, returns home from a Hong Kong business trip, and she brings with her a new deadly disease. 2 days later, she is dead.
You had a seizure this morning, Beth.
She had a history of seizures and allergies.
The film then traces the rapid spread of the disease from her to a global pandemic. This film attributes the origin of the disease to a piece of pork exposed to the contamination. At the Center for Disease Control, Dr. Alain Hextol determines the virus as a combination of genetic material from pig and bat-borne viruses. Almost 10 years later, the world is bracing itself with the impact of a new disease. The outbreak of the SARS coronavirus in 2002 infected more than 8,000 people from 29 different countries and territories. At least 774 people died worldwide. The outbreak lasted about 8 months as the World Health Organization declared SARS contained on 5th of July 2003. Almost 2 decades later, the outbreak of a new coronavirus disease named by the World Health Organization as Covid-19 has caused a global healthcare crisis. Both of the outbreaks began in China, and when traced in viral origin, both viruses were found to likely originate from wet markets. With SARS, the virus was traced from cats, while with the COVID-19, early reports indicated that infection from a bat crossed into a pangolin and then into humans. The precise location had been narrowed down to a specific wet market in Wuhan. However, those early studies have since been refuted. It remains unclear and unlikely that a pangolin was involved. The first case of someone suffering from COVID-19 in China can be traced back to 17th of November 2019, according to media reports. The report in the South China Morning Post said that China authorities had identified at least 266 people who contracted the virus last year and who came under medical surveillance, prompting authorities to announce emergence of the new virus. The Chinese government was widely criticized for attempts to cover up the outbreak in the early weeks, including crackdowns on doctors who tried to warn colleagues about a new SARS-like virus which was emerging in the city of Wuhan in Hubei province. As people everywhere celebrated the start of a new decade, 2020, the World Health Organization reported that hundreds of people in Wuhan had pneumonia with no other clear causes or origin. But there was one common thing that connected the patients: seafood in a Wuhan market. Many of these first cases were linked to workers at the market. As a precaution, the market was shut on January 1st, 2020. Nearly a week later, on January 7th, Chinese authorities revealed they had identified the cause of the pneumonia, a new virus in the wider coronavirus group, which includes SARS. 2 days later, on January 9th, the first death was confirmed. A 60-year-old man. He was a regular visitor to the market. At this time, Wuhan's Health Commission said there was no evidence the virus could spread between humans. Yet by week 2, the new novel coronavirus wasn't just affecting China. On 13th of January, Thailand reported its first case. The first death in Wuhan, China, came just before the Chinese New Year, the country's biggest holiday, in a time when millions travel across the country and abroad. As planes left Wuhan, so too did the virus. On the 15th of January 2020, Japan reported its first case, then South Korea the next day. It was confirmed that coronavirus could pass from person to person, and official figures became clearer as the World Health Organization (WHO) started to publish daily reports. This is when the numbers erupted, with all continents now affected. Everyone was told to wear a face mask. On 23rd of January, it was announced that all public transport was to be shut down. Anyone wanting to leave Wuhan city was given 8 hours before all exits were closed and the city went into a lockdown. On 30th of January, almost a month after learning about the outbreak of the virus, WHO declared a public health emergency due to the global spread of coronavirus. The United States also declared a public health emergency and said it would begin to temporarily suspend entry for foreign nationals who had traveled to China in the last 14 days. European countries began to evacuate their citizens from China and quarantine them for 14 days upon arrival. On the 2nd of February, the first death of coronavirus was reported outside China. A 44-year-old Chinese man from Wuhan died of the virus in the Philippines. Egypt was the first African country to report a case on February the 14th, 2020. Experts and African leaders had expressed concern that should the virus spread there, it might wreak havoc among less developed countries with fewer health resources. Lesotho became the last country in Africa to be afflicted by the virus on May 13, 2020. On March 13, 2020, Kenya's Ministry of Health confirmed the first COVID-19 case in Nairobi. The case was a Kenyan citizen who traveled back to Nairobi from the United States of America via London. She was confirmed positive by the National Influenza Center Laboratory at the National Public Health Laboratories of the Ministry of Health.
I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya. The case was confirmed on the 12th, which was last night, as the first one to be reported in Kenya since the beginning of the outbreak in China. The case is a Kenyan citizen who traveled back to Nairobi, returning from the United States of America via London, United Kingdom, on the 5th of March 2020.
On March 16, 2020, the country was in a partial lockdown after President Uhuru Kenyatta announced the closure of schools and imposed sweeping travel restrictions. Travelers from any country with a single case of the virus were barred from entering Kenya for 30 days. Only Kenyans and foreigners with residence permits were allowed in as long as they agreed to be quarantined.
I therefore want our people to be mentally prepared and to accept that COVID-19 victim bodies shall be disposed in a manner that protects the living from infections and in accordance with the Ministry of Health burial protocols.
I've had a few cases of people with special needs, like breastfeeding mothers, people with physical disability. And of course, we have taken good care of them like the rest of the other people.
The virus was spreading fast, and within 3 weeks, the impact was being felt outside the capital, Nairobi. On the 6th of April, President Uhuru Kenyatta imposed a 3-week ban on movement in and out of 4 main coronavirus-infected areas, including the capital, Nairobi, Mombasa, Kilifi, and Kwale, before the usually busy Easter weekend.
The cessation of movement within the Nairobi metropolitan area shall be for an initial containment period of 21 days with effect from 7 p.m. Monday, the 6th of April, 2020.
On 7th May, the government also announced a partial lockdown on 2 virus hotspots, Eastleigh in Nairobi and Mombasa City, for 15 days, and a curfew starting 7 p.m. to 5 a.m. All public places in the 2 areas were shut down as the cases tally for the 2 areas stood at 68 and 64 respectively. Kenya's case statistics as of May 7th stood at 582 cases, 190 recoveries and 29 deaths. Nairobi and Mombasa were the most impacted counties.
Let us brace ourselves for bad news.
We're working hard as a ministry to make sure that we have sufficient capacity in terms of internet so that people can be able to have the connectivity and video conferencing facilities that exist.
Where we are having a lot of challenge in terms of behavior change, in terms of the call for social distance is still in the counties, especially the rural counties.
As the containment measures began to control infections, so did countries began relaxing their vigilance. On October the 7th, Kenya's Minister of Education announced that grade 4, class 8 and Form 4 learners would report to school beginning Monday, the 12th of October 2020, as the government began phased reopening in strict adherence to COVID-19 rules. Learners, staff and visitors to schools were expected to wear face masks, have their body temperatures checked, and wash hands or use sanitizers.
Examination timetable, there are no changes because, like I said, we are not planning for now to shut down because of the COVID. If that's time comes, we shall tell you.
On November 4th, Kenyan health officials reported that the public had failed to follow health protocols to limit the spread of COVID-19, leading to a spike in daily infections. Kenya's President Uhuru Kenyatta reintroduced new measures to curb the virus's spread just weeks after easing some restrictions.
And anyone wishing to hold such meetings should do so in town halls, and in doing so, must observe all COVID protocols, including limiting the attendees to 1/3 seating capacity of the hall and the wearing of face masks.
I urge for continued collaboration between members of county assemblies and governors during this period. This collaboration should foster accountability measures and ensure expediency in the procurement of services for our people, especially in our county hospitals.
The World Health Organization has advised people to adhere to laid down preventive measures, including washing hands regularly with soap and water, wearing a face mask, and socially distancing at all times. But even as the approval of at least 3 types of vaccines bringing a ray of hope to the fight against the pandemic, reports of a new COVID-19 variant first reported in England that officials could say up to 70% more transmissible have emerged. The new coronavirus variant has prompted the UK government to impose a Tier 4 lockdown in London and southeastern England and tighten restrictions for all of England over the festive period. The fight against the deadly COVID-19 disease continues, with hope that life will return to normal sooner as scientists work round the clock to find a cure for the disease. Purity Museo, Channel 1 News, Nairobi County.